motivated people's concerns about health reform, at least for the first 6 months, is we can't afford this.
Jeff Bauer is an internationally recognized health futurist and medical economist. As Vice President of Forecasting and Strategy for Affiliated Computer Services, he forecasts the evolution of healthcare and develops practical, creative approaches to improving the medical sector of the American economy.
The future of healthcare has never been less certain and never been more exciting. I mean, this is a great time to be in healthcare because you've got to change. More of the same won't do. And there are some neat opportunities for you if you look at your potential. Now, health reform. Now, what are the take-home lessons, and then how can I tell you to deal with this? I think there are several. First of all, the only area of agreement, bipartisan, Republican and Democrat alike, as the health reform debate began, was that the medical system and the national economy are heading toward disaster if systemic problems in delivery and payment are not solved. And I think everybody still agrees with that. We must change healthcare in the United States. We must learn to do better with what we've got because it can't keep growing. No, it's a boomerang, and it's going to come back to get us. It's still more than we can afford. And indeed, you can look at the numbers. I'll leave it to you if you want to digest this, but debt is going up. We're spending way too much money. The law's implementation will produce many surprises and unintended consequences as the regulatory process interprets legislative intent. I don't even begin to tell anybody what to expect other than to be surprised and expect to be disappointed. Because we're seeing fewer people get insurance by virtue of employment. We're seeing the debt transferred to generations yet unborn. We're seeing things like mandatory insurance in 2014, but the mechanisms to pay for it start right now. Again, you can go back and look at all the detail. We're not producing the physicians, the nurses to provide this extra care should it materialize. As we've recently seen, the CHIP, the state health plans, you remember, were passed a year previously, and yet there is not a single additional pediatrician or nurse practitioner to take care of all those kids that have insurance. And you can look at states like Massachusetts, where the waiting time has risen from an average under 2 months to up to 7. We don't have the personnel. Providers must respond to the economic crisis much sooner than any federal reform programs will be implemented because purchasers and patients can't afford to increase their spending on health care. Yeah, we're given this illusion of people getting more insurance, and there's no money for it to happen. And again, you can look at the details, the unfunded obligations at the state level. We have states, mine, Illinois, anybody here from California, Pennsylvania, that are in serious financial difficulty, and yet the responsibility shifts much of the implementation to the states. And you can see cities less and less able to pay for new services. Look at the increase just since 2006 of people's deductibles on health plans, almost doubling, in fact, more than doubling. And yet the poverty rate's the highest it's ever been in the last decade. Moody's has downgraded the bonds of the majority of not-for-profit hospitals. That's why I know so many of you are gloomy. It's not a pretty picture. And economists don't think the employment will ever come back. In fact, there's a very serious, I think even consensus view in the economic community that a large percentage, the majority of the millions of jobs lost in the last couple of years, last 2 years, will never be restored because suddenly we're discovering how to be much more productive with the workforce we've got. You can use these new technologies. So we're not going to return to the heyday of 2006, 2007. Healthcare businesses should not focus exclusively on federal regulation of reform because it's going to vary significantly by state. Even if I were to tell you how to interpret the federal law, how it plays out is going to depend very much on where you live. And indeed, the abortion debate will really reignite that issue at many states level. Providers and payers cannot achieve the improvements in cost and quality by increasing productivity of labor because your personnel are working at or beyond their level of capacity. An information technology-based performance improvement is the only available mechanism to reduce the waste, the unnecessary expenses and unacceptable quality, because nothing else is going to do it. And that leads to the take-home lesson of partnerships. Again, you've got to find out who do you need to have on your side to develop what a term I borrow from the scientific community, collaboratories. Who are the other people that are doing research in this field that you need to get along with? And you've got to do it soon. You can't wait for 2014 or 2018 when you could have spent that time trying to build something that makes sense in your own marketplace.